Hi everyone, and welcome to your last educational video as part of your 90-day back pain program. For today's presentation, I'm going to be talking about the recurrence of back pain and the facts which are vital to understand when it comes to the long-term management of back pain. So, you're near to completing this 90-day back pain course, and we hope that you have seen and felt some big improvements when it comes to your back pain, as well as your general physical and mental health also. But I'd say the big take-home message that I want to get across in this video is that we'd be silly to think that your back pain is now cured and it's treated, and that you'll never suffer from any back pains in the future, because realistically this probably isn't true, although it sure may be for some of you. A more suitable terminology would be to say that your back pain is now much better managed, and you have the tools of exercise, your education, the advice, and the self-management techniques to stack the odds in your favour in terms of back pain prevention and symptom reduction. And I think the absolute best advice I could give is that we have now given you the tools through this exercise classes and the educational videos to inform you on what your back can tolerate, but also that your back will be able to tolerate more the more you exercise and solidify the foundations that you have built over the last 90 days. And that future setbacks are simply just setbacks and don't mean that your rehabilitation and management isn't working. Injuries happen, and no matter how much we do to try and prevent them, sometimes we just need to accept it, manage it, and then get back on the road to recovery. So maybe in the coming months or even years, you do get a back pain flare-up, which you're all too familiar with. Make sure not to think, oh, my rehab, my exercise, my management program isn't working, so I'm not going to bother sticking to it anymore. Use the tools we've given you to manage your flare-up. Reflect on what triggered your flare-up. Maybe you slacked with your tennis ball release for the few days prior to it, or you had an unusually busy day moving furniture or out in the garden. So reflect on these possible triggers and then learn from these experiences to help further reduce potential future back pain episodes. But a big point to really understand, as I'm sure you're already aware from your personal past experience, is that back pain is a really tough nut to crack. It's a recurrent problem. Once you have an episode of back pain, there is a 60% chance that you will have another episode of back pain at some point in the future. But many other injuries have a high recurrence rate also, such as ankle sprains, for example. Once you have an ankle sprain, you are much more likely to sprain that ankle again in the future. And that's just because it's the nature of injuries. So football players or runners frequently suffer from ankle sprains, and especially those with previous sprains will have a few exercises in order to help prevent future ankle sprains. But just because they go through the motions of completing these rehab exercises doesn't mean that their risk of spraining their ankle again in the future is reduced down to 0%. And it's the exact same for back pain rehab. Complete your rehab exercise, be consistent with your self-management techniques, but try to accept, as debilitating and frustrating as it is, that you may not be able to fully prevent all future back pain episodes. But with the advice, the tips, and the tools you've learned from this course, you're so much better prepared to prevent and manage your back pain going into the future. And I'd say the failing of rehabilitation is not due to the onset of an injury or a flare-up in your back pain symptoms months or years down the line. The failing comes from not managing your flare-up effectively and not reflecting and learning onto what triggered it so that it can be prevented or helped to be prevented in the future, and not being consistent with your prevention plan, whether that be going to 2 Pilates classes per week or going to the gym or swimming. It's all about that consistency. So the fact that you may have a future back pain flare-up episode doesn't mean that your rehabilitation is failing or has failed. Think of it more that a lack of consistency is more of a failing in the management plan. So do your educational videos, your self-management, your advice, your tips, your exercise, and stick with it. And as long as you are consistent with those, you are not failing your back pain management program whatsoever. And there's been a massive shift in the health and fitness world over the last several years, of a focus being on prevention over treatment. And that's from scientific research to funding and participation in rehab programs or activities to help prevent injuries. And rightly so, preventing an injury is so much easier and less complicated than having to manage an injury. For back pain, managing a flare-up knocks you back to being barely able to get out of bed, with a debilitating and a painful few weeks for the symptoms to settle. I, for one, would much rather spend a few hours every week completing rehab exercise to prevent these injuries than a flare-up leaving me unable to do anything for 4 to 5 weeks, ish at a time, which would hugely affect my quality of life. And there's nothing really too complicated or fancy when it comes to back pain prevention. The less you do to prevent a back pain flare-up, obviously the more likely you are to have one. Whether this be not exercising, not completing the self-management techniques, not having a monthly lower back deep tissue massage, the more things you can do to prevent the onset of back pain flare-ups, the less likely you are to suffer from one. And as we know, no particular form of exercise is superior. You've been introduced to more of a Pilates style back pain rehab over the duration of this course. And if you'd enjoyed it, I'd recommend continuing with Pilates. But if not, the Couch to 5K, which we did an educational video on, or maybe going swimming or to the gym, tennis, any sport, you name it, it works for the prevention of back pain, because exercise is key. But I've got to say, there's been a lot of information that's been rolled out over this 90-day course, purely because back pain is a complicated injury, which takes a lot of understanding as to how to best manage and treat it. And obviously not everything is going to stay fresh in the mind, so please do make the most out of the educational videos, as they are just as important as the exercise itself. Knowledge is power when it comes to back pain management. The more we understand about our body and our back pain, the better equipped we are to manage it. And we've covered loads of different sort of topics within these educational videos, from lifestyle factors to the facts around back pain, looking at the pains and is it all in my head, to the importance of strengthening. So, do revisit those, as those really key important points are just as relevant now as they were at the time when you listened and watched that video. So in a few months down the line, you are thinking maybe about joining a gym or purchasing some home weights at home, go and have a listen again of the importance of strengthening video, because it may just give you that little bit of an incentive and motivation that might be the best step forward for your management program. And I say, enjoy the last week's exercise classes, and you'll be sent one final email on the last day of your course. And this video will be a bonus summary video from myself, where I'll be summarising how to get the most from this course now that you have finished the 90 days. We hope you've benefited not only physically with your back pain, but that you also feel more confident and able to push your back to exercise without fear of causing damage or harm to your body. And well done.